purpose of this video is to demonstrate how to appropriately don and doff our PPE, cluster care while working with patients in isolation, and receive help from other healthcare staff while minimizing their exposure. The patient is Mr. Jones, a 40-year-old male who presented to the emergency department with shortness of breath and fatigue. He has a mild history of COPD, type 2 diabetes, and hypertension. He has recently come back from his trip to Europe. In the emergency department, he was tested for COVID-19 with results pending. He is now admitted to the floor for further management. He is currently in a private room with droplet contact precautions in place. His latest vital signs are heart rate 110, blood pressure 110 on 60, respirate 20 a minute, saturation 97% on room air, temperature 37.5 temporal. He has an 18-gauge peripheral IV in his left arm. After morning rounds with the physician, there is an order for the primary RN to give a 500 cc bolus over 1 hour, with a maintenance fluid rate of 75 cc's an hour.
I've gathered all my supplies to administer the IV fluid bolus. I have my IV pump with the correct solution. I've already primed and set. I also have my flush and an alcohol swab to start the IV bolus. I will do a quick visual inspection of the room to ensure there's nothing obvious that Mr. Jones needs. And it looks like he doesn't, so I am now ready to don on my PPEs. I will start with hand hygiene. And I will first put on my gown. As I'm putting it on, I really want to make sure I tie it twice. Once at the top, and on the side as well. Perfect. Now that my gown is secure, I'm ready to put on my goggles and my mask. The mask goes on first, hitting below my chin and fitting to my nose. My safety glasses come next. And finally, my gloves. As I'm putting on my gloves, I want to make sure that my wrists are not exposed. Both sides. It looks like I'm ready to enter into the room. Hi, Mr. Jones.
Hello.
I'm just here to administer the fluid bolus we talked about. Excellent. So let me just hook you up. That looks pretty good. Just swab it and flush it. Good. Okay. And I'll start your fluid. How are you feeling right now?
I'm actually feeling a little short of breath.
Oh, really? Well, I'm just going to start your fluid. And let me just check your oxygen saturation level, okay?
Sure.
Excellent. Let me just check your SATs here. Can you take some deep breaths for me?
Sure.
Excellent. Excellent. And you're sitting nice and high already. Let's check that. It looks like your saturation was only at 91%. I'm going to just put some nasal prongs in, okay?
Sure.
I don't have any here. I'm just going to call for help.
Hey Anna, how are you doing in there?
Oh, hey Zach. Mr. Jones's oxygen saturation is only at 91%. I want to put some nasal prongs on, but I don't have any in the room. Can you grab me some?
I can grab the nasal prongs. Do you want me to come in?
Oh no, don't come in. I don't want you to be exposed. But actually do call the doctor for me. Just let them know about his status change, okay?
Okay, I'll grab the nasal prongs and let the doctor know.
Great. Okay. So just take some deep breaths for me while Zach's grabbing some nasal prongs, okay?
Sure.
Excellent. Oh look, he looks like he has some there.
Hey Anna, I got the nasal prongs and left them on a table outside the room. I paged the doctor
know what? Mr. Jones needs some water as well. Can you grab some water too?
Okay, I'll grab the water.
Okay, great. I'm just gonna take the nasal prongs out. There we go. Just gonna apply the nasal prongs on, okay? I think I'll start you on 2 liters nasal prongs. So let me just put that on properly. Get a little snug. So try and take some deep breaths through your nose, okay? Excellent. Let's see if that helps a little bit. Nice deep breaths. Oh, looks like it's starting to work. Oh, you're up to 98%. Excellent. So we'll keep those in for now, and I'll just wait for your water. Oh.
I have the water here, Anna. How are you doing in there? The doctor paged back and is wondering about Mr. Jones' status now.
Well, can you tell him that his oxygen saturation has improved to 98% after applying 2 liters via nasal prongs? And also let him know that I have started that fluid bolus if he wants to continue it.
Okay, I'll communicate that and then report back to you.
Excellent. I'm just going to grab the water. There you go. So we'll just wait to see what the doctor says.
Sure.
Excellent.
Hey Anna, the doctor said that there is no other action indicated, but continue with the IV fluid.
Oh, excellent. So is there anything else that you need at the moment?
No, this should be fine. I'll be comfortable.
Excellent. So the fluid bolus will continue, and then the IV maintenance fluid will start right afterwards, so you won't see me back here in an hour. However, you do have your call bell if you need anything else.
Sure. All right, thanks for the great care.
Awesome. I think I'm ready to don off now. So to safely doff, I'm going to remove my gloves first, ensuring I'm doing a glove-to-glove and skin-to-skin technique. Dispose of that. Perform hand hygiene. I am also now ready to take off my gown. I will start with the top, and then the middle. I will lean forward, shake off my gown, and roll it into itself. Dispose to the laundry hamper and hand hygiene. I will now exit the room to finish doffing. Now that I've exited the room, I'm going to perform hand hygiene, getting ready to take off my glasses. I will take the glasses off, assuming that this space is now contaminated. Perform hand hygiene one more time. And gently take off my face mask by leaning forward and disposing it straight into the garbage. I will perform hand hygiene. And the final step is for me to actually clean my glasses. For that, I need to take new gloves. And I need to clean the glasses twice to ensure they're properly disinfected. Once to clean and once to disinfect. So I will take a wipe. I will clean the glasses from the inside out. In total, I want to make sure there's at least 60 seconds of wet contact. I will also use the wipe to clean the surface of the table. And I will clean it one more time. This second wipe ensures my safety glasses are fully disinfected. I will clean this table. I can use water to clear off any residue, or I can just leave it to dry. And I'm done.